Hi everybody, it's Karen and I'm here to talk to you about my innovation project. And I chose to talk about how we can improve the safety of PCA pumps, which we use with our patients to help control their pain. These PCA pumps are a great option for administering pain medication to our patients. However, there is room for improvement to make them even safer for them. And I chose this innovation because of a situation I found myself in several years ago after undergoing an extensive abdominal surgery. I was given the opportunity to use a PCA pump. The unfortunate thing was that each time I pushed the button, it didn't seem to be working. So after mentioning to my night nurse every time she took my vitals that I didn't think it was working, it was ignored. So by morning time, I was in so much pain I couldn't move and I was in tears. After mentioning this to my morning nurse, she immediately went to check out the pump and noticed that each time I pushed the button to get pain medications, it was going onto the floor instead of into my IV. So either the pump malfunctioned or there was something wrong with how it was set up. All I know is I received no pain medication that first day after my surgery. Needless to say, they were horrified and they made several attempts to give me other pain meds, but by that time it was just too late and they were really never able to get on top of my pain after that. And because of this, it just took me longer to become mobile and move around due to my lack of pain relief. PCA pumps have a lot of advantages to using them, as you can see here on this page, to treat acute, chronic, postoperative, and labor pain. They also provide a more consistent level of pain relief for the patient, and there's really no gaps in the pain relief also. They aren't having to wait for a nurse to find time in their busy schedule to bring them their pain medications because they control that aspect of it. And because the patient is able to control the administration, this gives them more autonomy over their pain management, which is a really nice thing for them. Less manipulation of the catheter by nursing staff will help to reduce the risk of infection. And these pumps are also much more effective at pain control than opioid injections and oral medications. There's also an advantage for us nurses in that they cause reduced workflow for us, so that's another bonus. So because of all these advantages, the result is a higher level of patient satisfaction when using this option of administering pain medication. But because of the experience I had, it led me to research how often this type of thing occurs and what other safety issues had come up when using these pumps. You can see here this on this page, many of the complications that have come up, and on this chart over here kind of lists each of the errors that have occurred the most and the number of times they've occurred. You can see that programming errors lead the way when it comes to increased risk to our patients. They can result in either over or under medicating patients. In fact, over medication has led to deaths. In a 4-year period, there were 710 deaths related to preventable errors. It can also increase the potential for medication errors if the flow rate has been programmed incorrectly. In my case, I was under-medicated, which led to a longer stay in the hospital and no pain relief. Another complication is the time and resources that are needed in order to use them. Not everybody's qualified to program these pumps, and specific training and education are required in order to be able to set them up. Another concern is the potential for the pump to malfunction, which may also result in over or under medicating our patients. Medication errors can also occur when the wrong dosage is programmed into the pump or the wrong medication is put into the syringe. It can be an error made by the doctor or the pharmacist when placing the order. Also, placing the syringe incorrectly into the pump and walking away before checking can result in the pain meds not even getting to the patient. PCA by proxy occurs when either a friend or a visitor, or a family member with the patient decides that they want to push the button for the patient because in their eyes, the patient is in distress and their loved one needs some relief. The unfortunate thing is this can also lead to unintentional over-medication and increased risk. Lastly, there have been issues with tampering. This occurs after the pump has been programmed and an individual has paused the pump and opened it to obtain access to the medication. Because opioids are typically used in PCA pumps, there is unfortunately a high risk of drug diversion. I'm proposing a safety protocol that would reduce, if not eliminate, the risks that we just talked about. It's going to be centered around software that's installed on each pump. This software will initiate a mandatory checklist that the person programming the pump will be required to complete. The checklist would take the programmer through various steps in order for the pump to start. These steps would include a patient information check and a prescribed medication and dosage check. The medication order would be synchronized with the pump programming before the pump will start. Once scanned, the patient information, medication, and dosage syncs into the pump programming. One great feature of this software is that the patient's MAR information will be synced with the pump. So once the patient badge and medication are scanned, it will need to match what's in the MAR, or the checklist will not progress to the next step. Without that progression, the pump just will not start. A great benefit to this feature is that because the pump's now linked to the patient's MAR, the nurse is able to monitor the amount of medication the patient's receiving directly from their computer. There's also going to be a mandatory check of all tubing to ensure it's attached correctly to the pump, as well as to the catheter on the patient. The pump will alert the nurse to any attachments that are not correct, and it will need to be corrected in order to move on to the next step. Also, if the syringe isn't placed accurately, the software will alert the programmer to recheck it. Another important feature that is included is a second set of eyes and another nurse sign-off to ensure everything is set up correctly before starting the pump. Lastly, there's going to be a test exercise to ensure that when the patient pushes the button, the medication is dispensed correctly before starting the infusion. These pumps are going to be equipped with alarms in the event that the pump malfunctions in any way. This alarm will not shut off until somebody comes in to check the pump. And the pump will also reveal what the issue is, whether there is occlusion or something's gone wrong with the pump. It won't start back up until it's been checked and the issue has been resolved. Once this has been implemented, we will see less risk of medication concentration and dosage errors, and less opportunities for improper setup of the pumps. Because these pumps won't start when there is a programming error, this will help to greatly reduce those risks. Patients will experience higher levels of satisfaction because they will have adequate pain management, which will aid in quicker healing times as well as enable them to become mobile much faster. And we all know that's better for our patients for a variety of reasons. The ability to monitor the PCA pump performance from the MAR will free up the nurse to provide other aspects of patient care instead of having to run into the room just to look at the pump for verification. My hope is that we're able to continue to take advantage of this valuable medical intervention that patients greatly benefit from with these new improvements so we can provide safer and more quality pain management for our patients. Here's a list of all the references that I used when putting this together. Thanks for listening and for watching, and have a great evening, everybody.